Yeah, thank you, Mr. Raj, and thank you, Dr. Gyani, sir. It's always such a wonderful experience listening to such pithy words of wisdom. I mean, these are the core fundamentals, you know. I mean, not only did he advocate about everything, but he went about it in such a methodical way, actually. So these 15 points are the real roadmap for any healthcare organization. So thank you so much, sir. And all of you who are aware, actually, on 27th of June, the organization which was founded by, created by, then built upon by Dr. Gyani sir, completed 15 years. So about, over those 15 years, so that means the NABH today is a teenager. And that teenager does not believe in words, but more into photographs and color and all sort. So I had a mind to actually, I'd planned to speak extempore, but when there was so much built up, and suddenly, the planning which went into this webinar, which is phenomenal. So I thought I'll quickly get together a teenager's collage of what the NABH experience about quality accreditation and beyond is. And basically, I'm going to talk about what we were, what we are, and what the future we aspire to be, or what the future holds for us. So this is the thing. So thank you so much once again for this opportunity. And talking about NABH, just quickly let me go through the brief for that. The India's tryst with quality dates back to 1947 with the Meteorology Department, the National Physical Laboratory, the Bureau of Indian Standards, and only in 1997 the Quality Council of India came in being. The chairman, current chairman, Mr. Adil Zainul Bhai, he is direct appointed by Honorable PM. Our Secretary General is Dr. R.P. Singh. So this is a collaboration effort. You can call it a public-people partnership between three main industrial bodies, ASSOCHAM, CII, FICCI, along with Government of India. And on the board, we have all major quality stakeholders which collaborate in various other aspects of quality, from industrial quality to lab quality to education quality, and NABH you know very well. So these are the system boards. But over the past 3 years to 6 years, there has been a phenomenal growth. And besides the 5 board, the NABH, NABL, which you saw, which so much in the news for all the right reasons now, and NABCB and NPPUK, which is our promotional board, we have so many divisions, about 750 professionals, quality professionals working hand in hand on hundreds of projects, from coal to fisheries to various other ministries. We are collaborating. We are proud to be associated with all international benchmark bodies. These are some of the ministries where we collaborate, and NABH itself is collaborating not only with Ministry of Health and Family Welfare, but a whole lot of industries, railways, MSME, FSSAI. We are actively collaborating with CDSCO and various other factors, so Bureau of Indian Standards. So this is just to give all our members, dear friends, the scope of the working of all our boards, especially NABH. So this is all that. NABL, you know, works for industrial labs also and works for medical labs also. So currently about 1200 plus labs, medical labs are there, but there are more than 5,000 industrial labs, which were in the news, like from the Citra lab, which were, you know, authenticating, the validating the PPE, which were in the news. So ranging from that to a whole lot of testing labs like biological, chemical, electrical, all these labs under ISO are only authorized to be given certificate by NABL. Talking about NABH, you know that currently we are proud and we stand tall on the shoulders of all you members, our assessors, our quality professionals, our doyens like Dr. Gyani, Lalu Joseph Madam, and Sanjeev Singh. So basically, we are currently running about 19 plus program. We are running under 3 broad headings: accreditation, certification, empanelment. Today, there is a partner bank of more than 9,000 different organizations. About 3,200 are empaneled agencies, about 6,400 accreditation certifications. So these are the vast reach of the national accreditation body, which I'm proud to represent here today. Of course, all of you are aware that NABH has been granted accreditation as an organization by ISQA. We are a member, we are an institutional member, of course, and we are into second cycle of our organization assessment also. and which is valid till, as you can see, July 2021. We are also, our standard, the fifth standard, received the accreditation recently. So talking about the past, the 2020, I mean, it seems so far away now. The January we started our bang, we released our standards, the fifth edition of hospital accreditation standard, which were due and which were very thoroughly revised by a very glorious technical committee with all of your opinions, all stakeholders inputted, and beautiful document was produced, which we launched on 15th of February. So this is that book. This is the guidebook. Standards are freely available, downloadable from our website, and this is the guidebook, which has a nominal price. So which also meanwhile received the accreditation by IEEA. So this is a proud moment for NABH that the fifth edition received this thing. We started off the year, like I said, with the inauguration. We launched our Quality Connect initiative, a small newsletter which we had to build up, and we cut cakes actually. So we cut cakes wherever we went. We went on to Ayush Ministry, where we relaunched our entry-level Ayush program with active participation of Ministry. Ayush Ministry is a very favorite child of Honorable PM, and he has lots of hope of standardizing the Ayush infrastructure in the country. And NABH is very proud to be associated from the formative stage of all Ayush standards, which is a vast reach. I mean, there's lots of standardization coming that way. And then we started off with our Assessor Connects and Refresher courses. So we had a series of programs. This is just a snapshot. Like I said, it's just a collage. So, and we connected with all our assessors. Actually, this was a really good experience for me, very humbling experience for me. Some of the very senior people, hands-on, passionate people, they got in touch. We had their blessings. They came, they shared their thoughts. It was the best experience of my life. I mean, this is a wonderful experience. We cut more cakes on the side. This is Mumbai. That was Bangalore. Hyderabad was left, which we attempted to do and did successfully on a virtual mode. We initiated and launched a umbrella of quality campaign. So before monsoon, so all those umbrellas are lying. I mean, practically all of us are working from home, and rains have come, they are going, but those umbrellas, maybe next year we'll bring that up. So that was an idea. We improved our capacity building. This is the secretariat which you see. We started, this is a psychoanalysis workshop, communication workshop. So this was the internal trainings which we did. On the right, you can see this is the code blue for our own people. So that's the initiative. So all our officers now are basic life support trained. So they've received that training. Various other trainings we did. We reached out to WHO. Actually, we had planned to become a preferred partner, and Mrs. Khetarpal Singh was very supportive. But again, I mean, we improved our own policies. We improved our certificate. Now all our certificates carry about 7 encrypted marks. So they are a wonderful piece. They are a university standard, and there are lots of built-in security features, because there were complaints coming that some people are just misusing the logo, displaying wrong certificates. We are still working on that, but this was just a small beginning. We reached out to all our assessors. So besides the full accreditation program, we have a large pool of entry-level assessors. So we connected with them, and of course we cut more cakes. So cake cutting was becoming a ritual when COVID struck. So COVID, we don't want to talk about COVID, but COVID is a reality, and COVID changed everything. So how did it change everything is that it gave us a lesson that is not the strongest of the species that survives, not the most intelligent, but the one most responsive to change. So this is the change which stimulated us to adapt and overcome. So with that in mind, we went about a new lifestyle. Masks are a new lifestyle. We off and on are working from home. Our offices are open, but then somebody turns out positive, then we work from home. So those options are always there, and they're likely to be till a good vaccine, effective vaccine is there. So we learn to live with that. We learn to salute and recognize and salute new heroes. So all doctors, our sisters, our paramedical staff, OT professionals, ICU professionals, I mean, those are the people who are carrying on the frontline warrior. They are the true kings, true icons, true superheroes of today. So we salute them. And please join me in saluting. I mean, this is from the heart. NABH is at the front line of saluting such people selflessly or working selflessly. We learned to work from home. There were, of course, challenges, actually, lots of challenges, actually. For the first 15 days, we were just, pulling out dusty policies when the lockdown began in the end of March. For 2 weeks, we were kind of disoriented. We just thought we will revise our policy, hoping for a early unlockdown or early opening, but that did not happen. So after 2 weeks, we started to find our bearings, and I must place on record, all our lady officers, they overcome all challenges. And just like today's date, today's 24/7. So we attempted to, mix all boundaries. So if not 24/7, at least 18/7. So 18 into 7, 18 hours they're working, and lots of effort they've put, hundreds of meetings they've convened, and very methodically each program we are now looking. So working remotely with kids, with husbands and wives, and I mean, so this was a good experience. But then became the wave of e-meetings. So we tried to connect to all our stakeholders. So these are just different screenshots, just like today's webinar. We put in a system on all platforms, starting from Zoom to this and that to that. We explored all, we found our golden mean, and now practically it's a seamless experience to connect with so many people. We connected internationally to ISQA. We launched different new standards. And then once our core operations were streamlined, we started doing committees. We started on to the e-learning part, which we were kind of till date, let's say, not very actively, maybe not very actively trying to connect to people. So we jumped onto the webinar bandwagon, if I can say that. And webinar, there were about 45 to 50 webinars over 2 months from the relevance of quality. And I must say that this pandemic also taught us the real value of quality. I truly believe and truly submit that all our hospitals, whether they are impaneled or whether they are accredited or certified, they have some idea. They adapted very well to the new SOPs, to the changing SOPs, because practically every day things were changing. So due to this change, those hospitals which were already aware of NABH, they grasp things very quickly. As Dr. Gyani sir also said, I mean, accreditation gives you a way of life. It's a thought process. It's not just a certificate to hang on the wall. It is something to cherish. It's a way of life which everybody inculcates and builds upon. So that was that. I mean, there were lots of webinars. I mean, our Code Blue, we can call it a webinar which went on for 2 hours. Just, all these are there on the website also, at least the main ones. This was attended by 4,200 people, and we realized the value of Connect, actually. So 4,200 people, and if we were to count today's YouTube, it's there on our site. Anybody can log in and see, and these are real experts who taught them. So this is there. So maybe 6,000, 7,000 people have already viewed that. So lots of webinars went on till we started getting such memes, I mean, and these were reality. And that kind of, so we trying to slow down again. Then we thought, people are kind of saturated or super saturated with webinars, and we moved on to our core trainings part. And our trainings also, like we said, that guidebook, and we promised that first 1,000 people who invest in this guidebook will get a 10-hour certificate course. I sincerely apologize for the delay. We had planned to do it in June, then July, but we are definitely doing it in, we got an overwhelming response. 800 people have enrolled, and I sincerely apologize for delay beyond our control. Actually, the printing press was shut down. We gave an order, then it shut down. I mean, this was genuinely not our fault, but printing is now in process. Hopefully before 15th, the edition, it's a beautiful edition now. We have made so many different changes, color coded, everything. So you will have this with you by 15th, and by August 10th, we'll be announcing the date soon. We also promise that Quality Connect will go on, and Quality Connect initiative is a series of webinars. Like Sunday, we have a documentation control happening. So please register, it's free of charge. and they'll be paid training, but we have cut down the logistic fee since there's not going to be any meal and 5-star experience, and you can learn at your pace sitting in your home. We have slashed down the costing to make it very, very reasonable and nominal. So please join us and participate and cooperate, and let's see how things go on. Digital health, which Mr. Raj also had been strengthening. So digital health was one area. It was a low-hanging fruit, because telemedicine, Board of Governors in supersession of MCI, they started to they legalized telemedicine, and with telemedicine there were hundreds of platforms which have arisen. So which is the best actually? So with digital health comes a new power to take technology to the masses, hub and spoke model, the reach to the different areas. But with power comes responsibility. So keeping that in mind, NABH initiated the digital health standards, and this is going beautifully. We have active support and nomination of National Health Authority, Ministry of Health and Family Welfare, Bureau of Indian Standards, every big WHO, and daily we have one guest speaking to us, like from Australia, from US, even President of US Technology Advisor addressed us day before yesterday. So this has been a really enriching experience for us, because digital health is beyond telehealth. It is much more. It is about what Dr. Gyani also said, point 14, and Raj also endorsed, that electronic health records. So all the realms of information, security, privacy, interoperability, medical tourism, what data to pass to the other country, what data should be remain, and what should be that format of data. And what about that iWatch which you are wearing actually? Where does that data go? Which server does it collect? mHealth, So all these are core areas which are working, and we are totally aligned with National Digital Health Mission and National Digital Health Blueprint. All these factors, we are working very closely with them, and we hope to give a good standard, very palatable for doctors, because we don't want a technology jargon filled with various. I mean, it's a very tough experience, but for doctors, I mean, we plan to make it as easy as using WhatsApp. So let's see whether we succeed. It will be graded model, systems approach, and we hope to give that by the year end. So after keeping it in public domain. So that is one area we worked on. Talking about future actually. So future, as everybody said, is uncertain. That's just this thing. There are tons of articles on the site about what does the future look like post corona, and we are not Nostradamus actually. Reimagining meditech, how technology will transform, looking beyond tomorrow. I mean, you search, you put that, and there's an expert talking about that, and nobody's right, nobody's wrong, because this is, nobody knows for answer. And what is the future going to be? Will we concentrate on home care or a tailor-made solution, digital, exponential? So all these are the buzzwords which are there, but just like I said, it's all gray, and not one gray, not 50 gray, but millions of shades of gray. So there is no right or wrong, but this reminds us of this great man saying that future depends on what we do in the present. So with that in mind, we kind of started working on today. As you are aware, we have resumed assessments as of, and we took out this thing, this circular, after doing 40 remote assessments. So as I'm talking, there are 4 remote assessments in entry-level certification going on right now. There are so many committees going on right now. I mean, so people are sitting. Yesterday's accreditation committee went on till 11:30. We started at 5, and our chairman, being what he is, the legend, he said, no, we'll have to do this, and everybody sat quietly till 11:30 in the night. So that is new experiences. We are there. We also plan to go hybrid. So there are lots of hospitals who are waiting for that, but hybrid means we need on-ground assessors. We are willing to send in local people, but only if their safety is assured. Because in case a hospital is COVID positive, we cannot take that chance despite PPE. So that is one area we are getting volunteers for that. People are volunteered. Hospitals are eager. Let's see how best and how early we can start the hybrid modality. And very soon we'll start that. But that safety of our assessors, our core strength, is paramount. We have started. This is an ad which I just quickly took from the site. Our Ayush Assessor Training Program is inviting applications. So all those, last date is still there. I think 10th of August is the last date. So I mean, just an example that we have resumed work. So all those, in case they wish to apply, they can apply. Obviously, there's the criteria and everything which will do due diligence. This is from today's meeting with ASQA board. So, so this was also a learning experience. So all of us are connecting, and we are planning a virtual conference also. So whoever does a conference, I mean, it's going to be a virtual experience. We've already done 3 conferences with CII and other associations, and they have been wonderful, like ET Tech Health. They have been good experiences with large gathering and very focused learning. So because there are no distractions now, I mean, there is no time away, but we miss that connect actually. So conferences will always remain important for a personal connect, the sideline discussions, sideline learning face to face. But since this is the new normal, we expect to do best with what we have today. And all this makes us realize that all we have is now. There are so many things beyond our control. I mean, so you have to let go of those things. There's nothing you can control, because there are supreme powers which are there. I mean, so that you have to realize, and this pandemic has thrown so much perspective onto that angle of life. But my only submission is, whatever be the change, whatever be the circumstances, if your foundation is correct, if your it's based on, your strength is based on solid foundation of probity, propriety, integrity, then you cannot go wrong. And NABH is the face of the industry, so that attitude we are trying to change. We have changed. I mean, our officers are very responsive now. I mean, they're learning because we are more in number. We are handling things, trying to handle things. I mean, we are not perfect, of course, but let's see. I mean, every day is a new beginning, and we're trying to improve. So service, quality, efficiency, turnaround time, we are working on that with active support of all you assessor and quality professionals. And thank you so much for bearing with us. This is a WhatsApp forward, but I believe this makes so much sense actually. It says stay grounded. So we are now, we recognize that we are a partner institute, as Dr. Gyani sir also said. I mean, we are not a licensure organization to issue a paper to be hung on a wall. We are a grounded organization, connect with the roots. So who are the roots? Our assessors, our hospital teams, you who work so hard. I mean, there's so much respect for NABH actually. So these, our nurses, nursing officers, our OT technicians, our paramedical staff, our doctors, of course. So all of them are roots. We intend to connect with you and keep connecting with our knowledge initiatives, sharing initiatives, and not for profit. I mean, we will do most of these. And we'll bring experts to you to connect and learn straight from them, because this pandemic has shown us a way of getting in touch. Turn over a new leaf. Yes, every day is a new leaf, and we have to learn to be flexible. Actually, otherwise we'll break. Flexibility in our attitudes. No, we don't want to compromise on quality. We don't want to compromise on our HIC measures, or what are the basic guidelines of a OT care or a good clinical care or good clinical practice. We will not compromise, but we'll compromise and deal case to case basis, because hospitals today and always have been facing different challenges. You know, our quality teams undergo so much of stress actually, because they are not given their due weightages, as Dr. Gyani also very rightly said. I mean, the CEO's management expects something, but they are, you know, they are the last room in a basement actually. During assessments also we record that and see that. So wherever, in whichever hospital, the quality team gets a room near the lobby or a room near the boss's cabin, I mean, those organizations really prosper. So the final message from this thing is to connect with nature actually. So somehow, somewhere we had forgotten, you know, rush this, rush that, mechanical, but nature takes its toll actually. It's claiming its own back. And if hospitals can also be there, you know, green hospitals, good light, there's so much sense in the ancient wisdom, well spaced out. So that we are thinking. Going forward, the best of countries which we aspire to be, isolation room, high pressure rooms, positive pressure rooms, negative pressure rooms. I mean, those countries are also reeling. So where are we lacking? So we need to introspect, and how best everybody in personal life, professional life can connect to nature. So that is important. And we must also not forget that quality for the last man actually. Whenever our policy or our standards our objective elements, our policies, our documents are of no use if we do not reach out to the last man, to the poorest of the poor. I mean, what do they matter? They don't know. I mean, keeping in mind our India's literacy rate, they expect the best. They don't know about our logo. But if a logo is on a wall or not there, at least we must ensure that we touch them in a positive manner somehow. So that is what I truly feel, and that is what NABH will go. I mean, we cannot give away, change a well-established system overnight, but our policies are to be made. If there's an entry-level certification, it should be a practical one. So we don't want a formality, I mean, we don't want a hung on the wall certificate and forget about it. So that quality intent has to be imbibed. Only then we are talking about herd immunity. So herd quality. I mean, everybody, you cannot create an island of quality. I mean, let's say one hospital is there and doing phenomenal, but till all the small clinics around that, small government setups around that, they come up, the public funded setups come up, or a doctor's clinic, they recognize patients' rights and responsibilities and other things. Till then, the herd quality will not come up. So that concept has to come up, outcome-based KPIs. So a final message, don't panic. I mean, so future is uncertain, but so is life. So don't panic. There'll be job attritions, there'll be pay cuts, which we all are facing, and suddenly everything is changing, the way of working is changing. But don't panic, because as some great philosopher has said, the final quote is, picture abhi baki hai mere dost. I mean, so this is the great learning, picture abhi really baki hai. So be positive, be really positive, and believe in NABH, believe in quality, safety, wellness, and we are with you. So thank you so much for this wonderful opportunity.
Thank you, sir. Thank you very much for the insightful session. I would request Dr. Sanjeev Singh to load the slide, just making you as a presenter. And wishing there would be more cake cuttings and, as an acronym, COVID acquired knowledge enhancements. Cake.
First opportunity, we are going to cut cakes, and
yes.
we hope to have all our expert panelists and other people in there, and we are always willing to have cut cakes and eat them too. Thank you so much.
Yes, sir. So the cake here stands for COVID acquired knowledge enhancement session. So more cakes for all of us. Over to you, Dr. Sanjeev Singh. Anybody wants to add on to the phenomenal work done by the NABH, and how you're all of us are looking forward to NABH spearheading us through various aspects, as how Dr. Atul had told us. Anybody from the panel?
No, I think that was a fantastic presentation. It was phenomenal, Dr. Atul. Very, very impressed. I think you are, the foundation was always strong. You're making it stronger, and it will get strongest under your leadership. It is amazing to understand the whole journey, the pattern which you have taken from your predecessors, and so much of work. I don't know whether I'm active, but I'm still very active quality champ, and I never realized that you're doing so much of connect. Definitely committees are going on, but then there are other educational activities which are also happening, plus reaching out with ISCOA, ASCOA. Phenomenal, and ministries.
Thank you so much, Dr. Sanjeev. Just to put things in perspective in numbers, over the past 2 months, we added about 1350 new entry-level hospitals into our fold. 1350 which were cleared CAPA, committee added rather. Committee went through, we processed 400 more. Full hospital accreditation, we added 97 more hospitals into our new hospitals we are talking. So we have been growing. Actually, this has been, we worked just like NABL for the labs. This was an opportunity to include them, and committee was very, very deliberately, they deliberated really hard, and other also. I mean, we are not even talking about the smaller, the blood bank. Everything is going a sea change. So we're trying to improve that. Blood banks is there. MIS second edition, we had launched that timeline. So those standards revision we have started. That entire revision process is undergoing with all your active. I mean, you have been a key part of our teaching programs, clinical audit, CQI. You are the core strength. So with all your Dr. Lalu madam. So all these people are the core foundation on whose shoulders NABH is trying to stand tall. So thank you so much from me to all of you once again, and all those people who are in attendance also. Thank you.
Thanks, sir. Over to you, Dr. Sanjeev Singh, for your session.